So today's the day. Astrid, our medical intern, is gonna get his PRP session. He wants fuller hair. And Astrid, tell us more. What do you want? Why are you doing this?
Okay, so I'm turning 21 in the summer, so I'm losing a lot of hair. It's getting very, very thin. I've talked to both Dr. Kassir and Dr. Sheila Kassir about getting a hair transplant. I'm not a good candidate just yet, so for us to sort of maintain my hair, get it more full, and get that growth that we're looking for back, we're gonna do some PRP to maintain that.
So what was our first step? We wanted to numb his head, and because I'm really nice to him and I don't want him to be in pain, I put a lot of numbing cream and I also gave him a nice hairstyle. So we're gonna wait 10 to 15 minutes now until the numbing cream kicks in. And while he's waiting, Maria, she's gonna draw his blood, and then we start.
Okay, so we have 2 vials of blood drawn from Astrid here. We're gonna spin this, and what we're gonna have is the platelets separate. And that's what we want to use. So we're going to spin these and you'll see them in just a second. Okay, so as you can see, this is the platelets and the stem cells. This is the red blood cells that are no good. We don't need that, we need this. So what we do is we draw 2 tubes. So this is about 10 cc's of PRP. A lot of the PRPs that are sold on the market, they're 1 tube and you get about 3 cc's of actual product to inject, but we have about 10 cc's. So we're gonna inject this and I'll show you that in a minute. Okay, so here's the PRP, can you guys see that? So almost 10 cc's. And we're just gonna inject anywhere you see thinning hair, we inject. And we're gonna do this everywhere through the whole scalp. I think this is hurting a little bit or no?
A little bit.
A little bit?
Yes.
So we just look at the areas that are thinning. This nourishes the hair, and it's going to make the follicle stronger, the hair thicker. There's 3 phases of hair growth: anagen, catagen, and telogen, or in other words, growth, resting, and falling out. This puts the hairs in a growth phase instead of a resting or a falling out phase. Okay, so we're done almost with the crown. We're going to move forward. And remember, any kind of platelets or regenerative medicine is about just that, where the platelets bring in fibroblasts, the fibroblasts bring in growth factors, and that's how we regenerate, rejuvenate. In the hair, we make thicker hair. In the face and then the skin, we make collagen. And in the joints, and orthopedic surgeons have used this for a long time, you grow cartilage. Okay, so Astrid has done PRP for hair thinning. Probably best for him to do a couple more sessions spaced out a month or 2. Then he'll be good for a while. Hair growth grows in about 6-month cycles, so in about 6 months he should see some thickening. For about 60 to 70% of the people, you really notice a good difference. Some people don't get that much of a result, but it works well for us. We do it for every patient that's getting a hair transplant, before, during, and after. So how do you feel?
Yeah, I feel good.
Okay, so we'll follow you and we'll show you results.
Okay.